Hey everyone, it is Kevin Henry, the editor in chief for DoctorBicuspid.com. We are continuing our Cellerant CEO series today. Super excited to be joined by Jinesh Patel, who is the founder and CEO of Uptime Health. Hey Jinesh,
Good
how are you?
good to meet you. Thanks for having me.
Hey, glad to have you on. I'm really excited to hear more about Uptime Health, but hey, give me your impression. What is Uptime Health and what do our listeners need to know about
Yeah, Uptime Health is an equipment management platform. It basically helps people understand what they have in their dental offices and make sure that they know how to take care of them, keep them in compliance, and even know where to go when something breaks down and predict when the next failure is going to happen. So, really, it's a place that's meant to be a one stop shop for equipment management for dental offices.
it? And I love that. I mean, I did a little bit of research on this before, and I think it's fantastic. And it was one of those things I'm like, why didn't somebody think about this before? Because I think it's such a fantastic thing because so often dental practices don't think about their equipment until something bad happens, obviously.
Well, I like to think about like a car. And the thing about a car is when you go down and you turn your key, you expect it to work and get you to wherever you're going immediately. The moment it doesn't turn on, or the moment something malfunctions, and you see it all across your dashboards, chaos ensues. Whether you miss your meeting, you miss your appointment, you can't get to where you're trying to go to, and now you have to fix this thing too. So you've added a lot more stress to your day, as well as you can't get what you're trying to get done. And so when I think about a dental office or any medical practice, equipment operates in the same way. You expect it to work when you come in your doors and take care of patients with it. The moment it doesn't, that's when chaos ensues. You're not taking care of patients. You're rescheduling them for later. Maybe they don't come back because they're a first time visit. You're not billing for services on top, and you just create some chaos. And so the moments that we can have to reduce that amount of chaos is kind of exactly what we're trying to accomplish here at Uptime Health.
And when you're talking about equipment in the practice, I mean, I think compressor, sterilizer. I mean, is this everything that you guys are covering?
Yeah, we say everything from a handpiece to a CBCT essentially. If
Wow.
you're using it for patient care, we can manage it with our tool.
Okay, so give me the inside scoop. How do you do that knowing all the brands, knowing everything else? I mean, 30,000 foot view.
Yeah, it's really tough, but it's also, we build it as we go. So let's say we have people that we're working with. We will first send a technician out because a lot of times they don't even know what they own. They have a concept of, well, we do have a few chairs, we have a compressor, we have a sterilizer, but they might not know the make and the model and the serial number and all that other stuff. So we'll actually send out a technician on their behalf and gather all that information. So somebody who knows what they're doing, they'll now have the make, model, serial number, where it lives in their building, and as much data as we can possibly find. Once we put that in our tool, we can benchmark that against other people who have the same data. So if they have the same make and model, well, we know how we've set them up in the past. It takes a yearly PM to make sure this is up and running, a quarterly gasket change of a certain sterilizer, a filter change if it's a certain compressor. So we kind of build our own library as we go. And if it's the first time that we've encountered this machine, we can go look at the service manuals, or we can ask them for the service manuals and we'll read it because that's what we're experts at. And we'll then build out that product. And now it's part of the library for the go forward future. So some of it's build as you go. Some of it's just kind of communal, like group sharing of information, but it's all for the benefit of the next person. So I think that's where we're able to grow as quickly as we can.
So I love knowing the genesis story and where did the idea for this come from?
So my background is I'm a biomedical engineer. So I did equipment management for large health systems in the past, and it was my first foray into what is equipment management. I did device design and invention. My background's in tissue engineering and nanotechnology, so it was not anywhere related to equipment management. But once I got in that world after I got my MBA, I started realizing the importance of taking care of the equipment as part of the patient care environment. I never considered it in the past. I'd always thought I want to build the best products for the patients, but I never thought about the clinicians and the people servicing the tool until I got into that world. And that's where I kind of built the idea of, well, healthcare is three things in combination. You need a patient, you need a provider, and you need an instrument of some kind. You don't really provide healthcare without one of those three things, or you need all three things. One of them gone, you're not providing care. And I have that biased lens of that equipment variable or the instrument variable. No one else is really paying attention to unless you're a technician, maybe equipment salesperson, or like a biomedical engineer. And when we start thinking about our world is moving to an outpatient model of care, we're going into in homes, we're going into aging in place in your communities, we're going to urgent cares and surgical centers in your neighborhoods. Well, as we get further away from those big health systems where I used to work, you lose people like me inside those buildings because it doesn't make sense to have me there. And that became a reality to me when our health system started acquiring a lot of urgent cares. And I had to go audit them because they're coming under my compliance umbrella. And I realized, well, these are doctors and nurses and MAs and people who know how to take care of a patient very well. But they don't know the first thing about making sure their equipment is at its optimal performance. They know how to use it. They know some maybe general things, but not like the perfect things. And, it kind of started scaring me because the further away we got from the health system, the less that knowledge kind of translated down. And if I want to be a consumer of that world, which I am, I want to also make sure the machines that are taking care of me are calibrated and working correctly so I get the best care possible. So that was kind of the idea is they didn't have those tools. I looked far and wide actually to give them a tool because I knew we couldn't support them with the way we were built out. And I couldn't find anything. And I realized, well, maybe this needs to actually happen. I need to automate myself. So at least we can give them some idea of what they should be doing with what they own and not having to rely on somebody like me.
I love that. And I love that, whenever you're talking about this, I'm thinking about those rural dental practices out there.
Yeah.
They're really, technicians are kind of sometimes hard to come by. Is this a solution for somewhere in the panhandle of Oklahoma or the middle of Iowa or wherever it might be?
Absolutely. And that's kind of the passion part of this whole thing is access to care. And access to care meaning if the linchpin or the bottleneck is working equipment. Now, getting providers, there's already a problem, don't get me wrong. But let's say something breaks down and there's already a provider there. Getting that thing back up and running is now another bottleneck because there's not enough technicians to go around. If we can incentivize better equipment hygiene, because we can do that with our tool, it's like telling them, here are the daily, weekly, monthly, quarterly, annual things you should be doing to minimize those, emergency events. Well, you're improving access to care because there's less downtime and less moments to rely on somebody to come out to you. So of course, they're like one of our best kinds of people to work with. And the last thing we do is we built the first independent technician marketplace for biomeds. So what that means is if you have let's say a reliable technician you usually, use anytime something breaks down, and at this one time, and you're in a rural area and that technician is busy somewhere else, they might not get to you till 24 hours, 48 hours, 72 hours. And you might not be able to wait, especially if it's a compressor failure or a sterilizer failure, something that kind of shuts down a large part or your whole practice. So if we can give you a surge resource saying, look, I know you like that person. We're not telling you to not use that person, but in this pinch moment, here are all the other people we know within your radius that know how to work on that machine. Go dispatch them at this one time instead, just so you're back up and running. So the whole idea is uptime. And that's why we're called Uptime Health, is anything we can do to support. We're not telling you how to run your business, who to work with. We're just giving you more tools and resources to make sure that's never a problem for you.
It's the Cellerant CEO series where I'm with Jinesh Patel, the founder and CEO of Uptime Health. And Jinesh, I have to ask you because I think about those assistants that are in the practice that maybe don't have a lot of dental experience, and yet they're kind of overseeing now some equipment to make sure it's running properly.
Yeah.
Does this help some of those inexperienced team members that are coming into dentistry as well now?
Actually, that's a brilliant question because that was one thing we realized after we launched the product. It's not just knowing what you have to do, it's knowing how to do it. And so what we've done is we've created a task engine. So let's say I've assigned you a quarterly task that you're supposed to be doing to keep this machine up and running. Well, as part of that, you can actually put supporting links, like here's a YouTube video of how to actually do it. Or here's an SOP of what we've decided at our organization to do in this world. So we say we're going to purge our water lines this way. We're going to, send our spore samples out that way. But we now have a way that as soon as that task gets assigned to you, Kevin, the first time, you can look at those materials and you don't have to wait for somebody to show you how to do it if you're a self-helper. So that's one way of doing it. Now, the other thing is we're starting to work with some of the manufacturers themselves to help them create content with us. And I think that's the cool future that we're working on right now is using the people with the best source of truth to help you understand how to take care of your stuff.
And it's fascinating because that was going to be my next question, because I know some manufacturers may have their own technicians. Do they see this as a competition or an ally?
I think at the first outset, people look at us as a competition. I think anyone looks at new technology as how does this affect and hurt my business? And I think over time they'll realize, wait a minute, this is accretive or helpful to my business. And part of that goes to those who have technicians. They also know that hiring and finding technicians is just as big of a problem as a dental office hiring and finding a front office or an office manager. They have the exact same labor shortage problem. So if they're really looking at taking care of their clients in any way possible, and we're saying we're a surge resource capacity for when your stuff isn't working and making sure it's always up and running in that office, they realize that that's actually a benefit to their clients. Now, the other things that manufacturers do is some of them have great IoT equipment, like things that have internet connectivity, telling you what's going wrong with the machine, how it's operating, what it's producing, all the cool things that people are looking for in terms of the future of manufacturing. But what they don't know is how can people engage with that data that's going to help them out run their practice. So what we're doing is we're actually just working directly with them and saying, let us take in anything that's equipment performance related. If it's air coding, if it's just trends of like what's the voltage line, what's the ambient temperature, anything that we can help identify problems with the equipment, we can automate service requests. We can automate tasks. So, Kevin, a good example is you might not know your compressor is overheating because you don't go check it every day. It's in the closet somewhere, it's in an outhouse, who knows where it is. But if I have the ability to sense that working alongside the manufacturer, and I realize it's overheating or it's trending this way, before it becomes a problem, I might say, Kevin, here's a task assigned to you that says go check on that compressor. Maybe the door's closed all the way, maybe the windows or the fan's broken, who knows what's going on, but maybe you can fix it before it becomes a problem. Or we realize, no, this is a true error because we also have multiple heads failing at the same time. What we can do is we can dispatch a service tech from the manufacturer or the people that they use with all that information baked in, saying, Kevin, you're going to come out. This is what you're going to experience. It's this error code. Traditionally, it's solved by replacing this part. So you have all that in hand as soon as you get out there. And so you can fix it the first time you see it versus going there, diagnosing it, assessing the problem, going back to your shop, getting that part, coming back out the next day, installing it and making it up and ready. We reduce a lot of that, back and forth time too.
Wow. One thing I always love to talk about during this series is the CEO's mindset. And I'm curious, you mentioned you went back and got your MBA. What was it about business that really kind of drove you to not only pursue that, but to get to where you are today?
I think it's a fun challenge. I think it's more of there's a problem out there, and as an engineer, you always want to fix the problem. But as an engineer, you might not understand how fixing that problem also needs to make business sense. And I think that was the part I realized I was missing, which is, if you have a solution but nobody buys it, you don't have a solution because no one's using it. And really piecing together the last piece of like, okay, even if the solution makes sense and nobody buys it, how can we tweak it to make it start making sense? Maybe there needs to be a ramp up to where people have an education hurdle they need to get over. And I think that's what we experience with our company today. But I knew that going in. So I made sure that we're educating the populace just like this with podcast about why it's important to think about it, why thinking about it differently makes sense, and how it actually impacts your bottom line. And then over time, you start realizing, okay, this becomes status quo. And paying for a product that does something like this does make sense because it's going to help me in the long run. So I think all of those secondary, tertiary things beyond just knowing that the problem needs to be solved and what a good solution can be, I needed something more in terms of education and surrounding myself with smarter people than me. And I think that's what I focused on.
And I love to ask every CEO about the think tank that Cellerant is and kind of how important it is to have those people to bounce ideas off of, whether you're a dentist, a CEO, whatever your is. What is it about a think tank that's so important to not only your growth, but the company's growth as well?
Yeah, great question. I think the good thing about Cellerant is they have a lot of experts on staff. You have the Lou Schumans of the world, you have the Donovan Ditchers, you have the Melissa Turners, you have people who have done things in their own experience in their own lives, who have lived and breathed dentistry from, the moment they got to enter in their careers. And you have people like me who come from medical or engineering that really don't have all of those resources, today. And so I'm being able to not just access them, but then other people that are in that think tank that have different perspectives. They might have tried it, been there, done that. So it saves you a lot of learning curve. If you think about the most expensive thing a startup can do, it's learning. But if you think about the most important thing a startup can do, it's learning. So you want to invest in those moments where if you can short circuit that and you can create an ROI for yourself, you need to do it. So the Cellerant think tank has been, increasingly important to us and staying close to how they view the world and getting access to the people who might know more than us. I can't stress enough how important that is to any CEO.
And last question for you before we tell people how to learn more about Uptime Health is I always love to ask about is there a piece of advice that has helped you become a better business person along the way, or a mantra that you really live by whenever it comes to business?
Honestly, the business isn't you, it's the people you build it with. And I think that's something when you understand and internalize it, your life becomes easier because that translates down to making sure you're doing the right hiring practices. Are you hiring the people that you can trust when things get tough? Are you hiring the people who can think through the next steps so you don't always have to be that person? Because starting a business, you have an idea, but I guarantee you in 10 to 20 months from then, it's a different idea, a different business than you initially thought. And you might have had the skill sets of the day one idea, but you don't have the 10-month or 20-month idea that's coming down the line. So surrounding yourself with the right people, giving them the authority to make decisions, fail, do things that you're going to be doing as well, and allowing them to also just help improve your idea. Don't be scared if someone challenges you with, hey, this doesn't make sense anymore. We need to pivot this way. Just trusting the community you've built this with, giving them the power to feel that they're appreciated and part of that core team. The rest of it becomes easier because you have enough problems to deal with. And as long as you have a team tackling it, they're easier to tackle.
All right. Well, let our listeners know where they can learn more about Uptime Health and kind of where you all are in your business cycle right now.
Perfect. So you can find us at uptimehealth.com. That's where you can find a lot of information about us and what we do. We have a very active LinkedIn page and social media following, so you can find us at any of the Uptime Health handles. For where we are in our business cycle, we're past the product market fit stage. We have over 50 DSOs that are working with us at some capacity. We have over 1,000 locations that are on the platform using our tool, and we've inked a lot of great partnerships. So what we are today is just the tip of the iceberg, and we have so much more to come, and we're looking forward to it.
Well, looking forward to following that journey along with you. Jinesh, thank you so much for the time, man. I really appreciate it.
Yeah, appreciate you, Kevin. Thank you.
And thanks to all of you who listened to this episode of the Cellerant CEO series here on Powered by Dr. Bicuspid. We'll be back soon with another CEO to give you some more business tips and insight into the great things that are out there for the dental industry.